Hello participants, we are welcome to today's awareness workshop on hepatitis B virus, its symptoms, prevention, treatment and management plans. I am Oredolapo Oyidamola Kachna, an epidemiologist working with Dadomar Healthcare Services, Calabar. As we begin today's workshop, we will want to start by knowing what is hepatitis B. Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic disease. It is a major global health problem. It puts people at high risk of death from liver cancer. From the world statistics, over 257 million people of the world's population are living with chronic hepatitis B infection. Nigeria, with an estimated population of 190 million people, has a hepatitis B prevalence of 8.1%, which is almost 16 million people based on a recent Nigeria HIV/AIDS indicator and impact survey report. These 190 million people are my brothers and sisters. They are also your brothers and sisters. What can we do to help them? Let's look at what the symptoms of this killer disease is. Symptoms of a new hepatitis B infection may not be apparent in children under 5 years of age or in adults with a suppressed immune system. Among those aged 5 years and over, around 30 to 50% will show initial signs and symptoms. Acute symptoms appear around 60 to 150 days after exposure to the virus, and they can last from several weeks to 6 months in the body system. A person with chronic hepatitis B infection may have ongoing episodes of abdominal pain, persistent fatigue, and aching joints. Early symptoms of this infection may also include fever, nausea, which is vomiting, loss of appetite, dark urine, clay-colored stools, jaundice or yellowing of the skin, and whites of the eyes. Who is at risk of this chronic disease? Less than 5% of otherwise elder persons who are infected as adults will develop chronic infections, and 20 to 30% of adults who are chronically infected will develop liver cirrhosis and or liver cancer. What are the ways through which hepatitis B virus infection is transmitted? Hepatitis B can be spread through blood transfusion, sexual contact with infected person, through tattoo or acupuncture with unclean needles or instruments, through sharing needles during drug use, through shared razors, toothbrushes, and nail clippers, or when we have direct contact with infected blood. In addition, infection can also occur during medical, surgical, and dental procedures. We need to be watchful and take care of our health and be sure of things that we use, especially during medical procedures. Hepatitis B virus can survive outside the body for at least 7 days. During this time, the virus can still cause infection if it enters the body of a person who is not protected by the vaccine. The incubation period of the hepatitis B virus is 75 days on average, but can vary from 30 to 180 days. The virus can be detected within 30 to 60 days after infection and can persist and develop into chronic hepatitis B. Are there ways through which hepatitis B cannot be transmitted? Absolutely yes. Hepatitis B virus cannot spread through food or water, through sharing eating utensils, through breastfeeding, through hugging, kissing, holding hands, coughing, sneezing, or insect bites. Diagnosis of hepatitis B virus. Blood screening is available for everyone to diagnose so that you can know your status, which is very important. A blood test can help a doctor diagnose acute and chronic hepatitis B virus infection. If the test confirms the presence of hepatitis B virus, the doctor may request follow-up blood tests to confirm whether hepatitis B virus infection is in its acute or chronic stage, the person's risk of liver damage, whether or not treatment is necessary. A doctor will recommend regular testing for people with chronic hepatitis B virus. Once the condition reaches a chronic stage, it can change over time. Hepatitis B virus infections can cause a range of life-threatening complications, which include cirrhosis, which is the scarring on the liver failure, and the almighty liver cancer. Treatments. There's no specific treatment, cure, or medication for an acute hepatitis B virus infection. Supportive care will depend on the symptoms. Anyone who has had potential exposure to hepatitis B virus can undergo a post-exposure prophylaxis protocol. Healthcare workers give the prophylaxis after the exposure and before an acute infection develops. For chronic hepatitis B virus infection, antiviral medications are available. A person with a chronic hepatitis B infection can develop cirrhosis or liver cancer rapidly and without warning. If a person does not have access to adequate treatment or facilities, liver cancer can be fatal within months of diagnosis. Prevention. The hepatitis B vaccine is the mainstay of hepatitis B prevention. World Health Organization recommends that all infants receive the hepatitis B vaccine as soon as possible after birth, preferably within 24 hours, followed by 2 or 3 doses of hepatitis B vaccine at least 4 weeks apart to complete the series. Timely birth dose is an effective measure to reduce transmission from mother to child. Hepatitis B virus transmission can also be prevented through quality assured screening of all donated blood and blood components used for transfusion, safe injection practices, safer sex practices, including minimizing the number of partners and using barrier protective measures such as condoms. The World Health Organization has issued out a call to everyone to help combat this killer disease. Hence, the purpose of this workshop and the campaign that is ongoing now in Cross River State, tagged Hepatitis B Free Cross River. You and I, my brothers and sisters, have the responsibility and the duty to know our status, that we can be able to help combat this killer disease and say no to hepatitis B virus infection in Cross River State. For further enquiries, you can contact me on +234 80 350 28580, or you email us at enquiries.dadomarhealthcare.org.ng. Our website is also out there through which you can reach out to us: www.dadomarhealthcareservices.org.ng. We are very grateful for the time you spent with us in today's workshop. We look forward to helping you creating an hepatitis B-free Cross River State. Thank you. Stay safe and stay blessed. Bye.